From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. This episode is your friendly reminder to call your dentist and schedule that routine dental cleaning. It might seem like a chore, but those cleanings are one of the easiest ways to keep your smile healthy and bright. Today, we're joined by Whitney DiFoggio, a registered dental hygienist, founder of TeethTalkGirl.com, and dental health educator. She's built an amazing community across her channels at TeethTalkGirl, educating both dental professionals and everyday people, making oral health easy to understand. In this episode, Whitney will walk us through what you can expect at your routine dental cleaning. Let's get into it. Welcome to the show, Whitney.
Thank you for having me.
So to start, let's just talk about why it's so important to go for those routine dental cleanings.
Yes. So it's not only the cleaning, but when you go to your dental cleaning appointment, it's also a checkup. It's a checkup and a cleaning. So not only are you getting your teeth cleaned, removing bad bacteria, helping reduce inflammation, you're also getting a checkup with x-rays, checking for cavities. You're getting an oral cancer screening. You're getting, again, with the gum check, we're perio-charting, we're measuring your gums, making sure that you don't have any signs of gum disease. So it's not just for a clean smile. It's really maintaining your overall dental health and oral health, or dental health and overall health.
Yeah, it really is a holistic appointment and so helpful to have somebody looking for things that we often don't even know that we should be looking for. How often should we ideally be going for these dental cleanings?
So for a healthy patient, and in the dental world for cleanings, we're talking about your gums. For a healthy patient, it's all about their gums. It's every 6 months.
Okay.
And if your gums, when we perio chart, when we're taking those numbers, when they're like 1, 2, 3, 2, 2, 3, 3, 2, 3. When we're taking those numbers, if you have 1, 2s, and 3s, you're considered a healthy patient. That's the every 6 months. If you're getting higher numbers, that's when we start discussing maybe you need to come in every 4 months or every 3 months.
Just to stay on top of it and make sure that everything is looking good.
As well as if you have periodontal gum disease, we need to maintain what you're having so it doesn't get worse.
Okay. I think that there are so many people who, even hearing what you're saying right now, are probably tensing up a little bit. Like, what if I have a cavity? Or what if they notice something? They might feel shame or embarrassment around that, or they haven't been for a cleaning for a while. What would you say to that individual?
Just to... So many things. It depends on the person. I never want to force someone to go, right? But I want to motivate them to go because I want them to know, dental professionals, we're not here to judge. It is our job to help bring your unhealthy teeth to make them healthy. We're here to bring health to your mouth. We're not here to judge. So never be worried about us, right? But if you're worried about maybe pain or maybe childhood trauma or the noises freak you out, there's so many different reasons that's why I never want to force someone, because I want to know the reason they don't want to go first. So my best advice is always just communicate.
And I love what you said about the fact that you're not there to judge.
No.
That's not your role. You've seen it all. So just book that appointment. Do you have any tips or practices that you could share with individuals who are feeling quite anxious when they're going in for their dental cleaning?
Yes. I always say communication is key. Again, you just let them know so we could accommodate what you need. I have some patients that ask me, please just tell me everything you're doing. They want to know. Right. And I'm like, okay, so right now I'm looking at this too. Like I tell them everything, but then I have other patients that they're like, I don't want to know nothing. And so they're like, just tell me about your life. I need to hear something. So I'm like, okay, so right now I'm in school, I just talk. And then there's other patients that want to bring headphones. Like if that works for you, you don't want to hear, you just want to be in your own world. Perfect. That's fine too. So just, everyone's going to be different. So figure out what works for you, just making sure you're comfortable and then going from there.
Amazing. Can you tell when somebody's anxious just by their body language in the chair? I'm imagining like there's probably some clenched hands and just I can tell when somebody's anxious.
I will say I know something's wrong, but sometimes I can't tell if they like are just very mad or if they're anxious. I'm always like, either this person's having a bad day and they're very angry, or they're just nervous and I don't, everyone has a different day. So sometimes I will say, are you mad at me or do you? And that always breaks the ice because they're like, oh no, I'm not mad. I'm just freaking out. I'm like, okay. Or sometimes they're like, yeah, sorry, I'm just in a bad mood. And I'm like, okay, at least now I know. Because it's true. If you're not saying anything and you're acting a little funny, it makes us wonder, like, is this person okay? okay. I mean, we are in a healthcare facility. I need to make sure you're okay. If I see the person sweating, or I need to make sure we're not having a medical emergency. So I hate to like ask, I don't want to pry into your life, but yeah, are you mad at me? That always helps.
I love that. It sounds like you're so supportive with what you do.
I just, we all have anxieties about things. We all have fears. Some people are scared of spiders, clowns, whatever it is. Some people are scared of the dentist. I get it. Yeah. Like that's your thing, and let's work through it. I wouldn't want someone, I don't even want to say my fear, but I wouldn't want someone to make me do my fear, so I get it.
Amazing. Let's talk about what happens when you're in the actual appointment. What does a dental cleaning entail?
Sure. So depending on if you're a new patient or a routine, regular patient that comes in every 6 months, you'll usually get x-rays. Everyone's x-ray frequency is different. So you don't necessarily need x-rays every single time. We look at your caries risk assessment, which is how prone you are to getting cavities, things like that. If it's once a year, if we need them twice a year, or once every 2 years. So you might get some x-rays. We definitely will check your gums. That's when we use that little, we call it a probe. It's a periodontal probe. And we take these little measurements. We go around, and there's a natural space between your gums and your tooth. And that's the space we're measuring to check if you have any signs of gum disease. We'll also check for recession. We'll just check everything that's going on with your gums. After all the assessments are done, we'll clean your teeth. If we'll decide which cleaning is best for you, which type of cleaning, and then do that cleaning. And then after the cleaning, we'll sometimes, polish, floss, do all the things after the scaling. And then the dentist usually will be in at some point as well to then review everything, review your x-rays, review the numbers that the hygienist took, the period charting numbers, and kind of go over everything collaboratively. The dentist and the dental hygienist, they'll kind of tell you what you need to do or what you don't need to do, and then you're off your merry way.
As kids, we used to, at that point, go to the little treasure bin and get the dentist rings or whatever it is, the little toy.
We still have those.
I just love that part of the dentist.
Yes.
I feel like it's so good.
And as an adult, you get a goodie bag. Usually you'll get a toothbrush, some
your
floss, a little mini travel toothpaste,
yes.
right?
Keep people coming back. Amazing.
Yeah.
You mentioned that there are different types of cleanings.
Yes.
Can you talk to me a little bit about that?
Yes. So like we were saying earlier, when we're checking the gums, if you have all numbers 1, 2, and 3, that natural space should be between 1 and 3 millimeters. If you have all 1, 2s, and 3s, you're in regular cleaning territory. You are healthy, just regular. Then I'm going to just say there's 3 different types of cleanings to make it simple, but there's more. But we'll just say that's the first easy one. Not easy. The first default normal routine one.
Yes.
And then the third one is a deep cleaning periodontal therapy, scaling and root planing, SRP. It has a million different names, but a lot of people just say deep cleaning. That's if you have 4s, 5, 6, 7, 8. When you have those higher numbers, that means you have some periodontal pockets. That means you have gum disease. And then depending on if you have bone loss, that's why x-rays are very important because we can see if the bone is lost. That's when you get into that deeper cleaning territory. And then the middle cleaning, I like to do 1, 3, and now the middle. The middle cleaning is when you're kind of in between. Yeah. Maybe you have some higher pocketing numbers, but you don't have any bone loss. Or maybe you just have really severe heavy buildup and we can't really figure out what's going on yet. We just need it. There's different middle ground cleanings.
Yes. Okay, amazing. Now, in the actual cleaning portion of the visit, you mentioned scaling and polishing. I can already imagine what the scaling is and the polishing, but can you break it down for everybody? What is scaling?
Sure. So scaling is when we use either an ultrasonic scaler or a hand instrument. That is a scaler as well, or curettes. There's different instruments, and we're essentially removing bacteria, plaque, tartar, also known as calculus, stain. We're getting all that gunk off your teeth. And what that does is it helps reduce inflammation on your gums, right? Because when that stuff is sitting on your teeth, all this plaque and debris and all this stuff, it's irritating your gums, and we don't want inflammation. So we're removing all that so your gums could breathe again and they can grow up and be healthy and pink. You want firm, pink, stippled gingiva. You don't want red, bleeding, puffy. And that's what we're doing, is helping bring you to that point.
And what is plaque and tartar and these different things that you're talking about? I feel like it's actually so cool and interesting to learn about what is actually happening on our teeth.
Yes. So plaque is that sticky white stuff. Sometimes it's stained that you can see sometimes, and you brush it right off at home. You brush, you floss, you can remove it. When plaque hardens into tartar or calculus, we'll just call it tartar. When it hardens into tartar, that's when you can't remove it. You could brush till you're blue in the face and it will not come off at home. That's when we need to use our instruments. And that's when you hear it, when you're getting that skin. You're like, ooh, that sounds like something. That's because it's essentially rock-like on your teeth and we're removing it.
Okay. And then the polishing happens after that. Tell me a little bit about the polishing.
Yes. Some people actually do polish first. It depends on your level of plaque or kind of the ideology that they're using for their cleaning. But whether it's before or after scaling, the polishing, it's like half cosmetic, but it's half therapeutic for health. So we're not only removing whatever residual stain is still on your teeth. So after we scale, we use the ultrasonic scaler, we use the regular scaler. After we do that and there's still some stain, that polisher gets it right off. And then you have nice shiny teeth. But the good thing that's a health focus, that's a functional, helpful thing, is making the tooth surface smooth allows plaque less likely to adhere or to attach. So the smoother your tooth surface.
That makes sense. There's not as much space for it to adhere to and to create buildup. So satisfying. You have such a satisfying job.
I do love it. I do love it.
It's amazing. And then one of the last things I remember at most appointments is the spongy like fluoride that's brought in. What is fluoride doing?
Yes. So fluoride is helping remineralize and strengthen your enamel. It helps reduce your risk of cavities. Okay. So most kids will get fluoride because anyone with a developing tooth will benefit because your teeth are developing and the nerve is bigger. And there's so many reasons why kids really, really benefit. As you get older, depending on your caries risk or your risk of cavities, you know, whether you need a fluoride treatment or not is for you to discuss with your dental provider. I'm someone who is like, anyone could benefit from it, right? However, there's the foam trays and then there's also the varnish. So, and you could also talk about because it's not just cavity prevention. When you're using varnish, it can actually help with sensitivity. I have some patients come in just because they have such sensitive teeth right at their gum line. We glob that varnish on there. It'll last them a whole year. They're like, oh, yeah. And they're like, I knew when it was time to come back because I needed that protection. So, you know, it's not going to work for everyone. That's like but yeah, there's just so many good things about it. And it's usually optional, but it's highly recommended.
Incredible. I always feel so good after going for my dental cleaning. And we were talking about it even beforehand, how you just feel like you're really taking care of yourself. And having that support of a team is so, so important in any area of our health, really.
Totally agree.
So I'm in the chair. I now have some polished pearly whites. And is there anything else that I should consider doing other than the cleaning while I'm already at the dentist?
Well, you already mentioned a fluoride treatment. That's a great thing to ask. I have a lot of adult patients that, or I should say people online, because I also do social media, and they message me and they're like, my dentist never asked me should I ask them for a fluoride treatment? Absolutely. Sometimes, I want to say it just depends on the office, but sometimes maybe dentists don't want to ask and keep getting turned down. Like, no. Like, they want you to ask. Like, you know, unless you really need it, they're probably not going to push you. It's a great beneficial optional thing. So you can ask for fluoride treatment. But yeah, if you like took the day off and you want to get everything done, if you knew you had a few cavities to be filled, just call ahead and ask, like, can we work that out? Like, where I see the dentist first and then the hygienist after, or something like that. So you can get everything you need done. Professional whitening is always an option if you wanted. I don't usually recommend professional whitening just because your teeth are going to be so sensitive, no matter if you have sensitive teeth or not. Some people, they have a wedding this weekend and they want to do it. I get it. But I would love if I recommend and kind of urge my patients to ask about the custom trays that they could make for you in office. So they're custom whitening trays. You can take them at home and then you don't have to worry about sensitivity. I'm just always so worried about sensitivity with patients because sensitive teeth that's not fun.
It's not ideal. No. And do you find whenever people are doing professional whitening, even if it's not after a cleaning, that sensitivity is going to be an issue? Or are they more sensitive whitening them after a cleaning?
I would say it doesn't matter if it's before or after. Some people might feel differently, but I also say if you want a good whitening treatment, you should do it after a cleaning because now there's nothing to inhibit the whitening from working.
Yes.
Sometimes you're just whitening the plaque on your teeth. You're wasting your money. So after a cleaning is the best time to put the strips on, or the trays, or the custom trays you had made in office, or if you want that professional one in office, you can do it. Some people might be like listening and thinking like, I never had sensitivity. You're very lucky because some people, it is horrible. Yeah. So I just be careful. That's why I recommend the things you can use at home for those, because if they start hurting you, you could take them off right away.
Right. You know, you can stop. Amazing. Now, when somebody's done their cleaning, how long do they typically need to wait before eating or drinking anything?
Oh, yeah. You don't have to wait unless you had a fluoride treatment, right? So the fluoride, let's start with the foam that you mentioned. Usually it's like 30 minutes before you want to eat or drink with the foam. With the varnish, it depends what varnish you're using. There's all these different ones, but always ask your dental provider. Sometimes you can eat and drink right away after the varnish, which is cool. That's a lot of kids pick the varnish because they're like, oh yeah, that one. I could eat right away. However, with the varnish, sometimes it will say 6 hours, no sticky foods or gum. Okay. So they won't want Twizzlers, gummy bears, gummy worms, because it'll just pull it off and then you wasted your money because it just went off. So it's not going to harm you. It's just going to waste
the time and the effort that went into it. Okay, amazing. Anything else that people should know after their appointment in regards to kind of maintaining the cleanliness, the freshness, that polished feeling?
2 things. One, always ask questions. Everyone's mouth is different. Everything I offer on social media is generalized advice. But when I'm with my patient one-on-one in the op, I could give them real advice, you know? But so always ask questions. Ask your dental hygienist who just cleaned your teeth, what do you think I should be doing at home? Because they know your teeth best. But for the second part, generalized advice is just try not to skip days. Consistency is everything with the brushing and flossing. That's not talked about enough, like in schools, you know, when people come to your school when you're a kid, maybe they talked about brushing and flossing, but they don't. It's just the importance of consistency is everything. And of course, doing it right, using proper technique. But you really want both.
Yeah, it really is true for anything in regards to our health and wellness is it doesn't necessarily have to be perfect, but if we can stay consistent with the actions, and especially with brushing and flossing, and then as you've mentioned, going for your dental cleaning twice a year, having the professionals take a look, check in on everything, and really make sure that we're getting all of that plaque and tartar off those teeth. Absolutely. Amazing. Let's do some of our Ask Me Anything questions from our audience.
So fun.
They always have the best questions. All right, number 1. Do children need professional cleanings as often as adults?
Yes, I say sometimes even more because, oh goodness, I love working with the kiddos because they think they're brushing so well and they're not, right? They're like, I brush every night. I'm like, okay, show me what you're doing. And they're not even touching their teeth. I'm like, what are you
Totally.
Yeah. So yes, children, although a lot of people think children's teeth, they're going to fall out. No, they're very, very important. You have baby teeth until age 12, 13 sometimes. So you're going to have those teeth for a very long time. You don't want to get infections. You don't want them to hurt. You don't want gum problems. You don't want any baby teeth issues cavities are contagious in a sense. They can spread. You don't want them spreading to the adult teeth underneath. Kids' teeth, so important. Every 6 months.
Why do young kids need dental cleanings if all their baby teeth fall out?
Oh yeah, so same thing. Even though the teeth fall out, like we said, they can spread these cavities. They're not just on a baby tooth. If you leave that cavity on a baby tooth, not only is it going to cause the poor kid pain, it's going to hurt. And then if it needs to be pulled because it's so bad, like root canal, baby teeth root canal, it is a thing. You can do a root canal, but sometimes they'll just pull it. And whatever the case, it depends what developmental stage you are with that tooth. But say they have to pull it. Now we're having spacing issues. If you have so many baby teeth pulled, now these adult teeth, they're coming in every which way. It causes a lot of, it's just a domino effect of issues. Right. So you definitely want to keep up with the oral care as a kid. Okay.
You mentioned that cavities can spread.
Yes.
I did not know this. Yes. Tell me a little bit more.
Yes. So within your own mouth, definitely. So a lot of times when wisdom teeth are a thing, right? Yeah. A lot of people need to get their wisdom teeth removed. They're either not fitting in their mouth or they can't clean back there or they're coming in wrong. So wisdom teeth often get tooth decay, like pretty bad decay, deep decay, because you just can't clean it if it's half stuck under your gum back there. And we see this all the time where your wisdom tooth is your third molar, right? your second molar starts getting decay too, because it spreads. It's a bacterial
The
infection.
bacteria is spreading.
Yes. And so that's within your own mouth. And it's not just wisdom teeth. I just use that example because that's what we see a lot. It can happen with any tooth that they spread. But also, there is evidence, to suggest that when you're kissing someone or sharing utensils, things like that, cavity, the bacteria that increases your risk of cavities spreads. The cavity itself doesn't spread, right? So if you're kissing someone with a bunch of cavities, you're not going to immediately get a cavity.
Right.
But now you might have some bacteria in your mouth that you didn't have before, and this bacteria is like, wait, we're gonna make some cavities. But if you're brushing, flossing, doing all the things, you'll combat that.
Okay, our next question: should I brush before going to my dental cleaning? I definitely do this. The week leading up, I'm like, okay, we're flossing full time now, brushing so carefully.
I love it. Yes. I never want someone to feel bad if they're like on their lunch break from work and they're like, sorry, I didn't have time to brush for a period. That's fine. But I will say, if you have time to brush, it really does you a solid to not waste your time with me picking food out of your teeth.
Yes.
You rather me take my time to be able to assess your gums and do a proper oral cancer screening, do all the things we have to do versus like getting the Oreos out of your teeth.
Yes.
You know what I mean? You want to not kind of, I don't want to say waste our time. Like I'm happy to pick the Oreos out. We only have so much time in that appointment. So it is helpful if you brush and floss before.
Amazing. Will cleaning whiten my teeth at all?
No. So cleanings might kind of make your teeth appear whiter because we removed all the stain. But what's underneath the enamel is to whiten them, you need to use professional whitening products with peroxide.
Okay. I think everyone's probably having that amazing moment, the reminder to book in for their dental cleaning and to schedule it in. And even while you're there at that appointment, booking in your next one. So it's in the calendar, it's already set. You know when you need to take time off or get coverage with your kids so that you can show up for yourself and your dental hygiene.
Yes. And I always tell patients, because sometimes they're like, 6 months, I don't know where I'll be. I'll just call. And I'm like, just put it in the calendar.
You are not going to call.
Yes. And and that's the thing. Like, if you need to change it, that's fine. At least you'll still be on pace.
Yes. Amazing. Thank you so much for joining us.
Thank you for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.